So hey guys, what's up? It's Stephen Dunn with CORE Therapy and Pilates today, and what I want to do is interview Dr. Danny on his most recent education since he's been with us at CORE. So first of all, Dr. Danny, thanks for joining us today.
Sure.
And he's been working with us now for I think about 5 months.
6 months.
6 months?
6 months.
In that time that he's come on board to work with us, there's been a lot of educational opportunities that's already that he's already taken advantage of. And one of the things I like to do is get together and have a bio update. And we can update the bios on the website, but I like to just kind of have a discussion and talk about it because it goes into a much greater depth. And so with that said, first of all, Danny, let's talk a little bit about the Pilates training.
Mm-hmm.
So Danny started working with us 6 months ago, had been exposed to Pilates when he had volunteered with us, shadowed with us before PT school.
Mm-hmm.
So just a little history, Danny was observed and shadowed with me for a summer, a whole summer I would guess, prior to getting into PT school. So he was able to see the things that I was doing with patients at that time, which were including hands-on, myofascial release, joint mobilizations type of stuff, and then Pilates and gyrotonic work. So with that said, when he came to work with us, one of the first questions that I had for him are you interested in getting trained in Pilates? And he's like, yeah, it's something I want to be a part of. So when he actually showed up to work day one, he was signed up with our Pilates program, which is basically a teacher training program. So Danny, tell us a little bit about kind of that experience with just tell us a little bit about the Pilates training, and then I want to know a little bit about some of the patients that you've utilized the Pilates equipment and concepts with.
Sure.
And just kind of give us a little bit of information about that.
Sure, yeah. So kind of like Stephen was saying, I've been exposed to Pilates just a little bit, but really like I hadn't had any like formal training or anything. So when I started here, you know, there's there's a bunch of different resources. There's teachers, there's Cheryl, who knows a whole lot, who runs the course. So there's like different videos, and we've done in-person, practicing different exercises, figuring it all out. And it's been a really great experience because it's been helpful, and especially for PT wise, because, a lot of it focuses on core stabilization, improving strength and mobility and flexibility, especially in, some of those core muscles, what we think about the core, like in your stomach, but it's also like a lot of it in your hips, which I feel like a lot of people don't think about or kind of miss with some of the like traditional exercises, and even just sometimes like traditional PT. So, it's been really great to learn a bunch of different things with on the reformer, and things, being able to control your core and properly activate things. So
now tell me a little bit about some of the patients, the types of conditions and things that you're working with using the Pilates reformer and different Pilates concepts with.
Sure. So pretty much I've been utilizing it with any kind of patient that comes in the door. So people with low back pain, whether it be, they have sciatica, or if it's something else, if it's just kind of like low back pain in general. I've used it a lot for shoulder patients as well, knee patients, people with pain in their hips. I've used it a little bit with people who have had foot or ankle issues. So it's a very versatile machine, and there's a lot of different things that you can utilize it for, and I found a use for it with pretty much everybody that comes in the door.
And that's pretty much the way I would have answered it too, because most people think you're going to say back pain or something, but it's really everybody. And what I've learned, if someone has a shoulder problem, we're teaching them Pilates. We're starting with breathing and proper placement of their low back and their pelvis. And some would say that doesn't have anything to do with their shoulder, but if you strengthen your core, it helps your shoulder placement, your scapula placement. If you're just trying to find your shoulder placement, and you're not aware of your low back, every time you squeeze your shoulder blades together, a lot of people are actually just arching their back. They're not actually controlling their shoulder blades. So Pilates is one of the things that taught me to look at the whole body. It helped me with my holistic approach to therapy, because a neck patient, a shoulder patient, we were starting at their abdominals, pelvic floor, diaphragm. We worked up to their shoulders or whatever their problem was. But I think that's a great answer. It can be applied to pretty much any type of injury, whether it's an ACL injury and you're getting back to playing sports, or you have back pain, spinal stenosis, ankle problems, shoulder problems, whatever. So it's a fantastic tool, and I call it a tool. The machine, the reformer, is a tool. It's a piece of equipment that has hundreds and hundreds and hundreds of exercises that you can do on it. So we can stick to like the same 15 to 20 exercises with a lot of people, or we can dip into 400 or 500 different exercises to pull from to help people with what they individually need. And to me, that's what's pretty fun about it. So with that said, thanks a lot for your commitment to getting better and serving the people of Westlake and Austin. And if you haven't been around and seen Dr. Danny, then give us a call or get on his book. He's got some great Google reviews so far. We'll post those at the end of this video. But thanks for watching, and thank you, Danny, and we'll see y'all around.